Michael Gallagher, you're a physical therapist. I launched my website and new YouTube page yesterday, and I've had many requests from families and friends since then. What about the back? I have back pain. So for all of you out there who made that request, we're going to talk a little bit about back pain today. Back pain is probably one of the most common injuries or ailments I see in my physical therapy office. During this time when people are stuck at home, quarantine, during the COVID-19 epidemic or pandemic, we're getting increased complaints of back pain from people who become more sedentary, people who are now doing office work, sitting in a kitchen chair, people who are spending more time in bed or on the couch. But to understand how we treat back pain, first we have to understand the different types of back pain. For simplicity's sake, let's break our back pain down into two major categories: discogenic or neurologic back pain versus musculoskeletal back pain. Now, many times these lines cross. Many times pain coming from a bulging or herniated disc or a pinched nerve will cause muscular back pain secondary to protective muscle spasm. And also patients who have musculoskeletal pain coming from the sacroiliac joint or the vertebral bodies, spondylitic disorders like spondylolysis and spondylolisthesis. This may cause muscle spasm. This muscle spasm can cause compression of a nerve, again, now causing neuropathic or discogenic type pain. So what is the difference between these two pains? The first thing I want to talk about is discogenic pain. What's a herniated disc? What's a bulging disc? Probably one of the most common questions asked to me in my facility. Basically, if we look at the spine, basically your discs are the space maintainers, the cushions between each of the bones, each of the vertebral bodies. Coming out of those vertebral bodies are our peripheral nerves. These nerves, or spinal nerves turning into peripheral nerves, these nerves control function and sensation. Muscular function, the ability to feel hot and cold. These nerves carry the signals from the spinal cord to the brain so we can move our limbs, so we can feel things. So what is the function of a disc? The disc, as I said, is a space maintainer or a cushion between the vertebral bodies, which allows the nerve to pass freely through this little hole or space called the foramina. When we have decreased disc height, whether it be due to aging, a herniation, or a bulge at the disc, that disc becomes narrowed or thinned, thus the nerve is much more likely to be pinched. Just quickly, people say, well, what's a bulging disc? What's a herniated disc? Easy way, or the way I like to explain it to my patients is, think of a disc as a jelly donut sitting between each vertebral body. Somebody sits on the donut, and that donut, all the jelly leaks or comes out to one side. Not leaking out of the donut, but all the jelly sitting on one side. You put the box of Dunkin' Donuts in the car, somebody sat on the box. The jelly didn't leak out, but all the jelly's been smushed to one side. That would be the definition of a bulging disc, causing a protrusion or bulge onto that nerve or nerve root, as demonstrated here. So basically there's your jelly, and the jelly is still within the donut, but pushing on that nerve. A herniated disc is a little more severe in that now somebody sat on your donut and the jelly's leaked out. It's leaked out into the space around the spinal cord, thus putting direct pressure on the nerve, and on the contralateral or opposite side, because that jelly donut is now smushed, compressing can occur there also. As soon as this occurs, the surrounding musculature will tighten up or go into a protective muscle spasm. This muscle spasm now has taken your discogenic or neurological pain and made it more musculoskeletal as well. So as I said, that's where the lines are kind of blurred between the two types of back pain. Quickly, non-disc pain, pain coming from your sacroiliac joint. the joint between your sacrum, the base of your spine, and your ilium, your two hip bones. Very, very common area to have pain and discomfort, especially during prolonged sitting or sitting in an uncomfortable chair. We want to address that, and we're going to talk about that a little bit today as well. Also, patients complain of spondylitic pain. As I said, spondylolysis, spondylolisthesis. That could be defined as a small crack in the vertebral body in an area called the pars interarticularis. What occurs with that condition is one vertebrae will slide anterior or forward on the lower vertebrae, causing a compression of the nerve root. Again, those blurred lines. Now we're talking about musculoskeletal pathology causing neurological symptoms or signs. What I'd like to do today is kind of differentiate between the two, but speak about general treatment to help to decrease pain in the low back, pain which may be radiating down into the buttocks or legs, by the use of modalities and stretching to help acute back pain until we can see our medical professional, our orthopedic surgeon, our internist, our physical therapist. The next video, again, we'll talk about how to treat this pain.